Hello, Facebook. Happy Friday. My name is Dr. Shayla Toombs-Withers. I'm coming at you live from the Essence of Health Wellness Clinic, located right here in downtown Chattanooga. We currently today have a bit of snow flurries outside, so it's kind of cold, but it's winter, so that's to be expected. Well, if you have been watching the news here recently, there has been a lot of discussion about the coronavirus. People are really getting afraid, of catching the coronavirus. We continue to hear about deaths from the coronavirus. And so I've just gotten a lot of questions about the coronavirus more recently. So I thought I would give you my take on the subject and a little bit of information that can just help you through this season in general, even beyond the coronavirus. So first, what is the coronavirus? Well, this time of year, we do see a lot of respiratory viruses. So flu virus is a very common respiratory virus that affects people this time of year. Rhinovirus, which some people may not have ever even heard of, but rhinovirus is one of the contributors to the common cold. Coronavirus has even been a human type of virus that has contributed to the common cold for a number of years in many people. But the reason we are now hearing more about this particular strain of the coronavirus because it's behaving a bit differently from our usual experience with the coronavirus. So this coronavirus, they're actually calling it the 2019 novel coronavirus. This particular strain of the coronavirus actually came out of Wuhan, China, which is where they first identified the virus, and they are believing that it may have been transmitted from animals to humans, and now it's being spread amongst humans, and people are getting really sick. And if you have watched the local news, there have been a number of deaths, particularly in China from this strain of virus. We have seen a few cases here in the United States. And so I'm sharing with you really some data from the Centers for Disease Control and Prevention, because they're our public health organization that actually tracks these type of things when there may be a public health threat to our country. And so in the United States, according to the CDC, the first infection with the 2019 novel coronavirus was reported on January 21st, 2020. So that's really not that long ago. So like I said, it's still very rare amongst Americans in terms of the number of cases that we've seen. And the thing that makes this virus more difficult to ascertain is because the symptoms of it are what we really think of as nonspecific. The most common symptoms that we see are fever, any temperature greater than 100.4, cough, shortness of breath. And when you think about it, those are actually symptoms that, a lot of people may experience this time of year, whether that be just from the common cold or whether that be from influenza. So it really makes it difficult for people to know if, they're being affected by this particular strain of coronavirus. However, I will add to that caveat, the CDC does recommend that if you've had any recent visit to China, and you develop these common symptoms of fever, cough, shortness of breath, then you do want to seek medical attention as quickly as possible, because they are capable of testing you for the coronavirus to make sure that you don't have this deadly form of the virus. And now the most common complications actually from the coronavirus is pneumonia. And so what happens is people, catch this respiratory illness, and then it prolongs in the system, it replicates, and then people end up catching pneumonia. And pneumonia really is the reason that people are dying from it. Usually pneumonia is the ultimate cause of death. So how can you protect yourself and your family and prevent spreading any type of virus in general this time of year, since we're all exposed to so many things? So the first thing you want to do is cover your mouth. Most of us are taught as children to cover our mouths, but people commonly forget. And when you cover your mouth, you don't want to cover your mouth with your hand, because by doing that, you actually spread those respiratory droplets to your hand. Then when you go on to touch a doorknob or you touch a shared microwave in your community room at your job, or you touch the water cooler at your job, then now you've just spread whatever you had onto everybody else. So when you cover your mouth, you always want to sneeze or cough into the cuff of your sleeve, into the elbow of your sleeve. So that way you aren't spreading those respiratory droplets onto other people. And then you don't want to frequently touch places on your face. So you don't want to touch your eyes, your nose, your mouth, unless you have just recently washed your hands really well. And the reason for that is, once again, if you have been using some community space where you've been touching or may have come into contact with other people's germs, then you go on to eat your lunch or have your coffee, or you wipe something briefly out of your eye. Now you've just spread whatever those germs were onto yourself. When you do wash your hands, you do want to remember to always use soap, use warm water. You want to lather and wash for at least 20 seconds to be sure that you are killing any potential pathogens or bacteria, those things off of your hands. And then you want to use a separate towel to dry your hands, and use a separate towel to actually turn the water off, so you don't then spread those germs back to yourself again that you had on your hand from turning on the water. If you don't have access to soap and water, use a hand sanitizer that contains at least 60% of alcohol in it, so that you can kill those germs off of your hand. Because these viruses are spread person to person, and that's if you're in close contact, so which the rule of thumb is usually about 6 feet. So if you just even talking to a coworker, talking to a family member, if you're close to each other, then you can spread these things amongst yourselves. Other tips: stay home when you're ill. Clean any surfaces, especially your computer. A lot of times we don't think of cleaning our computers or our cell phones. Get a Lysol wipe or a Clorox disinfectant wipe and just wipe those surfaces down at least once a week, just to kill any germs off of it, so that you don't continue to spread those things amongst your family. And the thought right now is that there is no vaccine to protect you from the novel coronavirus. So really prevention is going to be the key there. And then I bring all of this home to say, we have had a lot of uproar and a lot of concern about the coronavirus, but really here in America, the influenza virus really is more of a threat of harm to us at this present moment. We still have a lot of people out there who test positive for the flu virus, get really sick. We still see a number of deaths from the influenza virus every year, particularly small children, elderly, pregnant women. Those are our most susceptible and vulnerable populations. So it's still really important that we not forget the influenza virus while we're, may have a heightened awareness about this coronavirus. It's not too late to get the flu shot. We do have a vaccine for the flu, whereas we don't have one for the coronavirus. So go out there, get your flu shot, get your children a flu shot, so that everybody stays protected during this season. And just try your best to stay healthy. Vitamin C, particularly high dose vitamin C for adults, about 1,500 milligrams a day, can help boost your immune system and make you less susceptible to catching these viral illnesses. So just don't forget those tips to stay healthy in general. See, I've got a couple of people on the line watching, and thank you all for joining me today. I'm going to look through here to see if I have any questions from anyone particularly. So from Iso Dion, she says, another reason to consider giving up meat. They certainly did find that this virus was spread from an animal. Now, I do not have the knowledge of knowing if this was an animal that some person ate versus a person who may have been working on a farm and actually handled something from an animal and got this virus from that source. So I'm not totally sure if that was related to eating meat or not. And then I have Sierra that says knowledge is power. It certainly is. I certainly agree with you. And the more we know, the more we're able to stay healthy and keep our loved ones healthy also. So I just really thank you all for tuning in. Once again, I am Dr. Shayla Toombs-Withers with the Essence of Health Wellness Clinic. I do want to make a little plug about Essence of Health. So Essence of Health is a direct primary care practice. For a monthly affordable fee, you are able to take advantage of unlimited office visits, same day or next day appointments, extended appointment times, 30 to 60 minutes in length. You also have access via telemedicine, which is really great for this time of year. If you're feeling ill and don't feel like you can make it out of the house, I can set up a video visit. You can text message me, and we can handle your care that way. You also have access to discounted medications and laboratory testing, all as being a member of the practice. I continue to waive the enrollment fee for this month. That's been our New Year special here at Essence of Health Wellness Clinic, which actually saves you $75 in that enrollment fee. So take a look at www.essenceofhealthwellnessclinic.com to find out more information, or give me a call at 423-225-2245 with any questions. I do have a couple of more questions here before I go offline. So one question is if I can talk about daycare and things we can do to prevent the spread among kids. Certainly. So with daycare, you definitely want to make sure that they are disinfecting all of the toys that the kids come into contact with, as well as any kind of shared bed spaces, any kind of shared toilets that the kids use. Most daycare centers will have a daily cleaning process because the state actually mandates some of that they'll have a daily cleaning process for most things. But those toys are key that you do want to make sure are being cleaned regularly so that kids aren't spreading these things. And then once again, you do want to make sure that your kids are vaccinated against the flu virus to at least protect them from that. And multivitamins, those are good for kids to get some much needed nutrients. Making sure your kids maintain a healthy diet to help keep their bodies and their immune system strong will certainly help to prevent your kids from getting ill. If you have a small child, usually children under 2, suctioning their noses to make sure they aren't very snotty, because that way they can continue to spread illness to others if they have a consistently runny nose. So suctioning their nose with some saline spray is another way to help kids there. Thank you, Heather, for that question. I have another question here from Jennifer. Hi, Jennifer. Thanks for joining me. What is the monthly fee? So the monthly fee right now at Essence of Health, it is $70 a month for adults, and adults are considered anyone over the age of 18. For children, it is $20 a month, and that is if they are joining with a parent or with someone who is on the adult plan. For children who are just joining by themselves and there's no parent or adult plan, it's $50 a month. And then there's also a college rate for college students age 18 to 26 with a valid college ID of $50 a month. Thanks for asking. Okay, well, thank you all so much for joining me. Remember, the essence of health is in you. Have a great weekend.